So let's get to it, and we'll start with the anterior head of the deltoid. The anterior head is probably the hardest to isolate in a workout, and I'll explain why in a bit, but first, gotta understand the anatomy. The anterior head is also called the clavicular head, and you can see why. While the other two heads of the deltoids originate from the scapula, the anterior head actually originates from a totally different bone, and that is the clavicle, the lateral third of the clavicle to be specific, hence clavicular head of the deltoids. And then it wraps around and inserts on the lateral edge of the humerus in what's conveniently called the deltoid tubercle of the humerus. So what's going to happen when the anterior deltoid contracts? Well, three different things. First, because the origination point is above the insertion point and on the front of the body, it's going to pull up on the humerus and flex it forward. Second, since the origin is more medial than the insertion point or closer to the midline of the body, it's also going to pull the shoulder forward in what's called transverse adduction. Adduction meaning bringing something closer to the middle of your body. And then third, since it wraps around the humerus to pull from the lateral edge, it's going to pull that in. And what that results in is medial or internal rotation of the shoulder. Now, I mentioned earlier that the anterior deltoid is the hardest head to isolate in your workouts. Now, if you watched part 1 of this series, then you might start to understand why. Because there's one other muscle that does all those same three movements: flexion of the shoulder, adduction of the shoulder, and medial rotation of the shoulder. What muscle is that? Pectoralis major. Now, look at the size of pec major compared to the anterior head of your deltoid. Which one of those do you think is going to win in a fight? So because of that, it's very difficult to take the pec major out of any of your anterior deltoid workouts. It will take most of the load away. However, one strategy to do that is to take the motion that is the major role of the anterior deltoid, which is flexion, which also happens to be a minor role for pec major. Now, one final tip on the anterior deltoid with that exercise specifically is that if you actually abduct your arm slightly as you bring it up or move it to the side, then you can isolate it better by taking pec major out of it a little more. It wants to bring your arm in. So by having slight abduction during that movement, you can be sure that you're not just working your chest and hit that main motion of the anterior deltoid still.